India, as we see it today, has rising health disparities with poor patient engagement and increased burden on healthcare professionals. What we're also seeing is the rise of lifestyle diseases in India. We are the epicenter for lifestyle diseases. We are the world's capital with reference to diabetes. We have increased incidences of heart attacks and strokes, and we can already see that our emotional, mental, spiritual, social makeup is actually currently broken. What we need in India right now is a holistic solution that will help people to stay healthy longer, fitter longer, happier longer. And this will change the entire health landscape of India. What I also see is that we really need a revolution. If you look at the healthcare, if I were to show you a pyramid, right? If I were to show you the pyramid, the top 5% of this pyramid, the healthcare pyramid, are people who actually need acute care. That means they need hospitalization, they need doctors, and they need sometimes even surgical interventions. The next 25% of the population is people who they have some sort of a lifestyle disease. They may be diabetic, they may be overweight, they may have blood pressure challenges or heart challenges. These segments of people need a specialist to work with alongside with a coach, because the specialist will give advice and suggestions on what to change, and the coaches will actually facilitate the clients and the population at large to make and implement those changes in their lives. The last segment of the population, which is the majority of the population, this is 70 to 80% of the population. This is kind of fairly healthy. This population segment is somebody like fairly healthy but has poor eating habits, poor sleeping habits. They don't exercise. They know it's important, but they really don't exercise. They are highly stressed, they don't sleep on time, they have unhealthy habits around smoking, alcohol, anger issues. A lot of these issues, which are the origins to most lifestyle diseases. So if we can actually, the 70% of the population, if we can help them cultivate healthy habits, sustain them, and really optimize their well-being, the likelihood is this 75% is not going to move to the next 25, and this 25% is not going to move to the top 5, which is getting into an acute hospital care. So my belief is that through health and wellness coaching and integrative holistic approaches, we can keep the bottom part of the pyramid, majority of the population, healthy longer, happier longer, and stop them from moving to the next segment. And people who are in the next segment, help them to have better health and well-being outcomes, and some of them maybe even come down to the majority of the population. So this kind of a client-driven, client-centric approach, which helps the person who wants to make a change empowered, when they believe in themselves, they tap into their inner resources, strengths. We motivate them in a manner that they can overcome any obstacle that they may have in achieving their dreams and aspirations. So that's my hope for India.